My name is Becca Ironside. I'm a pelvic health physical therapist. The purpose of today's video is to talk about wellness visits. Wellness visits are an online consultation provided to you from the comfort of your own home. You might be wondering, what is a wellness visit? I'm here to answer that question. Perhaps you have been to a specialist and you've received information about your pelvic floor, urinary issues, bowel issues, or sexual concerns. And you have more questions regarding how the information given to you from a specialist is impacting your overall health and life. Or perhaps you haven't been to a doctor or a specialist at all, and you've got similar questions, urinary, bowel, sexual, and how these things are impacting the way that you live each day. I'm going to give you an example of a wellness visit from 3 different men. They're going to ask questions about their pelvic health, and I'm going to show you exactly what information was given and shared with these men to help them gain a better overall picture of their health.
Alright, so I have this very high stress job where I'm constantly sitting a lot, and I've noticed that I have testicular tension when I sit and I no longer get my morning erections. So I'm only 28 years old and I've been to a urologist, but I don't understand what's exactly happening.
With each client who receives a wellness visit, we discuss the anatomy of the pelvis, the spine, the hips, all of the things that connect to form good bowel, bladder, sexual function. So in the case of this client, he sits a lot at work and he has a very highly intense job. So the testicular tension that he's experiencing may very well be a result of 2 things. It could be that his job is very stress-inducing, which we know, and it could also be that his testicles are in a place where they are being sort of compressed all day due to his seated position. So in this case, we discussed the anatomy of this man with him. We talked about the use of a specialty cushion, which could take away pressure from his testicles while he's sitting. Now, the second thing that we discussed with this gentleman was the morning erections. His loss of morning erections may very well be the result of not getting enough deep sleep, because that's what causes morning erections, and nocturnal erections is getting deep rest. So this gentleman actually took it upon himself to start meditating in the evenings before sleep for 30 minutes. And this calmed his system down enough where the morning erections returned. Furthermore, this man also began doing some stretches. He investigated stretches that he could do for his pelvis to really open up that area and release the tension that was being held in his testicles. So ultimately what he got from the wellness visit was learning how to decompress that region of his body, specialty cushion, learning how to stretch this region of his body, and learning how to calm down his mind for deep sleep so that he could have morning erections once more.
I had my prostate removed due to cancer, and I am now leaking urine, which I was told is normal. Something which surprised me is that my penis seems shorter than it used to. My surgeon never told me why. Can you explain why my penis seems shorter and how to address the urinary incontinence?
So this is a really interesting question, and I hear it a lot, both in my in-person pelvic floor clients and in these wellness visits, is that when the prostate is removed, the penis actually does get a little shorter, and we're going to talk about why. So I want you to look at this model here. This is a cross-section of the male pelvis. So what we have is penis, testicles, bladder, prostate. This is your urethra. It's going all the way from your bladder down to the penis, and it's carrying the urine with it. Now, what happens when we remove the prostate surgically is that this region of the urethra has got to be removed and then sutured back together. So if we take away this length of the urethra from surgery, we've got to take the bladder neck and we've got to take the urethra and we've got to get them together once more. So you see what can happen. It's almost like a high tension wire being pulled up. in this direction. So that can cause shortening of the penis in some individuals. And it's very helpful when they actually understand why it's happening, because it's disconcerting. So what has been shown to help in some research is the use of a penile pump. So it's a vacuum-like device where you're pulling the penis out in this direction, right? And so you're, in essence, lengthening the tissues that have been shortened surgically. Now, the penile pump is very helpful for a lot of men. Some surgeons recommend them post-prostatectomy, others don't. But it's a nice suggestion for men who are concerned about shortening of the penis. And this is what we discussed with this man. It wasn't in his mind. It was actually real. And using a pump has been shown to help. Now, the other thing we helped this man talk about was his urinary patterns. And we talked about what is a normal urinary stream, what's a normal pattern for urination. And again, we helped him understand the entire anatomy and what he went through with a prostate removal.
I am middle-aged, my kids are out of the house, and during COVID, I gained 30 pounds. My mom died and I developed low back pain. I love my wife, but our sex life is gone because my erections just aren't what they used to be. I haven't been to the doctor because these things seem to be a part of aging, not something that can be changed.
So this client represents so many people, not just men, but people who've lived through the last 3 years as we have. And it almost seems like there's one problem and then they just keep piling on each other like a mound of dung that's sort of rolling down a hill. And so the problem starts with COVID, gentleman gains weight, he lost his mother, starts to experience low back pain, and he's suffering from erectile dysfunction, right? So look at how many problems this guy's going through. What we were able to do with him is basically talk about the relationship between his overall health and what outside influences might have impacted him. So the weight gain is going to cause, for a lot of men, some measure of erectile dysfunction because you have these tiny little saddle muscles, and the more weight that you put in the system, the less likely these muscles are to respond the way that they did if, say, you were 30 pounds lighter. So the weight gain can absolutely impact erectile dysfunction. Also, this man's mother has died. And so we don't know what level grief is playing into his pelvis and his life. So he's grieving. We understand that. The low back pain is another concern. He's not addressing it, right? So, and then the erectile dysfunction. Now, what I like to say to men is your penis is the barometer of your health. So it's like a canary in a coal mine. So you start to get erectile dysfunction, and it could just be your mother dies or something tragic happens in your life. Alternatively, it could be something else. So with this man, we were able to discuss the relationship between all of these factors and how it might be impacting his erectile dysfunction. This wellness visit gave the man the courage to find a primary care physician. Finally, he went to the doctor. He told the doctor about his erectile dysfunction, his weight gain, his pain. The doctor ran a series of tests and found that the man had high blood pressure, which very well might have been impacting his erectile function. Think it's blood flow. So I really am so proud of this gentleman, and I love cases like this because it really just shows the second that you open your mouth and you start talking about an issue is when you can actually find help. And this man found help. He found a doctor. And so this is what it is beneficial about a wellness visit, is that you can sit and ask questions and we can discuss avenues where you can turn to find out what's happening from your own home. So now you've been educated on what a wellness visit can entail. We can discuss the interplay of what's going on in your body and how it's impacting your life. So you can schedule with me, and perhaps you should, because you're worth it.